Hello, Rob Lejeune and Dr. Michael Cimino here today. We are looking at a radiograph and a crown, an e.max crown on the left and an e.max radiograph on the left, and a zirconia crown on the right, and a zirconia radiograph on the right. Let's jump into the way e.max and zirconia behave differently in the radiograph, and then how they behave differently in manufacturing, and just what we're seeing here. So, Dr. Michael, just share with us what's been your opinion and your journey with e.max and your opinion and journey with zirconia, and then we'll kind of talk through some of the results that we're seeing here.
Yeah, Rob, thanks for bringing me back on. I appreciate it. I'm a general dentist that's been practicing for 16 years in restorative dentistry. I bought a milling machine back in 2014 and have been milling my own e.max for many, many years. And then after that, started designing with Exocad and sending my designs to the lab and just having the lab mill my e.max. Kind of took that off my shoulders. And a lot of the things I love about e.max is what I think a lot of doctors love is the fact that we can see through it on an
Yep.
x-ray. We know our margins are closed. I know zirconia is a really popular material for strength in the posterior, and I know that a lot of doctors feel that you can't do e.max on second molars, but I've been proving them wrong and doing e.max on second molars for well over a decade with very great success and very little fractures. But Rob has turned me on to our new zirconia material. So I've got a side-by-side comparison of e.max and the Rebel 3D Crown. Same design, same STL file, and it's pretty interesting the results.
So obviously the e.max on the left, you can see, your cement space, you can see the margin seal, and then the zirconia crown on the right. You can just see sort of the halo. Talk through these and just your experience and history with this.
Yeah, so on the left, we've got the e.max crown. This is a try-in x-ray, so it's a dry try-in. We're checking for margin fit. I love the margins here. I would easily deliver this crown, no questions asked. On the right, we have the Rebel 3D crown, also a try-in, no cement. There's no cement here. And one of the things that I did not like about zirconias in general is the halo effect around the margin. And I always questioned, even after delivery, seeing that halo around the border or the margin rather, if there was some type of micro gap there. Even though clinically I couldn't feel anything, I always felt like I questioned whether the margin was completely sealed. So clinically, what I'll tell you is same crown design, same STL file, and on the e.max, I could feel a click at the margin. On the Rebel 3D crown, very flush, very smooth. And these were designed the margin at point 0.1. So very,
For the
very thin.
zirconia.
Well, for both rather. Yeah.
Oh, okay.
Same construction file, same everything. And now, path of draw on both of these, the e.max took a little bit of pressure to snap in. I think the margin, I mean, the contact was a little tight. On the Rebel 3D crown, it dropped right in really smooth. And I think the
Hmm.
difference there is the Rebel 3D crown's polished. It's not glazed. Now, the e.max, it has to be glazed. So there is that
Yeah.
added thickness of the contact.
Yeah, we could talk here for a second around the Rebel 3D crown is a harvest nano zirconia that's milled and polished. And given the material, polishing the Rebel crowns is going to give an aesthetic result that is far superior to, if any of you doctors out there have polished zirconia crowns in the past, you can get like this, seashell effect. But the way that the Harvest Nano is made, I'll skip the whole scientific discussion, but we'll look at some clinical photos and see that they actually look really good because they're polished. The geometric accuracy of what Dr. Michael, what you designed, was being milled and captured, geometrically accurate in the milling process, sintering process, and because we're not adding glaze, we're not adding that 30 to 50 micron layer of thickness, which is in fact, making those contacts a little more snug where you might have to do an adjustment or you won't be able to floss through it versus e.max or any other type of crown that you're going to be adding glaze to. You tend to be adding a layer of thickness that could throw off the contacts a little bit. And
Yeah,
so
none of us like to adjust contacts, Rob. It's a pain, and quite often, your dentist is not adjusting with the proper stuff. I mean, look, I'm at fault for doing it too earlier in my career. You take a diamond burr to it and try to adjust that contact, but you're introducing scratches into the glass, and you can never really polish it up. And for those of us that are a well experienced dentist or adjusting our contacts if necessary with rubber wheels and things like that, and it really doesn't take much. I mean, it could just be a path of draw issue to get that crown to fully seat, but the polishing definitely makes a difference.
so far with the Rebel crowns that you've seeded, have you had any contact adjustments or have they gone in pretty flawlessly?
Zero contact problems, zero path of draw issues in seating, very limited occlusal adjustments if I've had to make any. And what I
Hmm.
did notice is that compared to the average zirconia crown, where you're adjusting with a diamond burr, sparks are flying, and with this, the material feels a lot softer to the touch of your diamond burrs. And so no sparks are flying, and it doesn't take much
Hmm.
and it polishes really nice with the Dialite ceramic polishers.
Yeah, what you're feeling there is the high density of the nano zirconia, right? It's a binderless zirconia. I'll probably do a whole separate episode on the science behind the Rebel Crown and why it matters. But we're able to get a thin margin, zero point 0.1 millimeter, and you had said you had no click in the transition with your Explorer from tooth to crown on the Rebel Crown, but you had a small click in the e.max crown, correct?
Yeah, and we as practitioners are busy, and as good as we all are and have loops and magnification, and we can prep these margins. Sometimes we don't get the most perfect shoulder margin for these ceramic
Hmm.
crowns. So occasionally there's a chamfer margin, and when you're designing these in Exocad or 3Shape, there's a minimum for the material choice,
Yeah.
and it's going to add back that thickness. So a lot of times you'll get your crown back from the lab, and if that margin is a chamfer margin, you'll have kind of a bulky margin. So it'll have kind of a bump at the margin.
Yeah.
And when you try to run your Explorer, that transition from tooth to crown, you're going to get that click. And with the Rebel 3Ds, it's flush. It's really nice and flush.
Awesome. Glad to hear. Glad to hear. Show the photos, inaugural photos.
Yeah.
We'll take a look at those and then we'll talk about some Exocad design.
Yeah. So on the left, we have an e.max crown, and on the right, we have the Rebel 3D crown. Both of these are A2 shade. So you can see the difference just in the coloring of A2 e.max and A2 on the Rebel crown. I think with this particular patient, the Rebel crown matches better
Yeah.
color wise. And the A2 here in the e.max, it looks a little dark. Um,
And tell me what the patient said on the feel of the surface of the Rebel Crown versus the Emax Crown.
Yeah, so I blindly tried both of these crowns in with the patient. I did not share with him what the purpose was or what I was doing. So I tried in the Emax crown first, shot the X-ray, did a margin check, and then took that crown off, and then I put the zirconia one on. And immediately he questioned me. He's like, "Well, this one feels different." I said, "Yeah, I'm trying this new material, and I want to see how it feels." So. Uh, the patient was the patient really likes science and that type of stuff, so he was really interested, and it kind of piqued his interest in it, and he said, well, this one here feels more solid. It feels like it's my tooth. And he was talking about the Rebel 3D crown. So I said, okay, well, let's try the e.max crown back in. So we tried that one in, And he's like, yeah, this one feels good too. He goes, but the other one, that one feels like I can really chomp on it. Eh. So I said, okay. I said, so which one? And I had him look at both of them, and he wasn't really too concerned with the color matching. But
They're very, very close. Yeah.
yeah, I said, if you had to choose, which one would you want? And he's like, well, I want to try out the one where I can chomp on it. And I said, well, I mean, we're gonna glue it on, so what you what you choose is what you get. And so he
Yeah.
thought about it for a second. He said, let's do the one I can chomp on. I said, okay.
Okay.
So, but you can tell, I mean, look, this is the same file. And just in these two photos, I can tell that the Rebel one looks to be a lot more precise. Even though they both fit well, you can kind of see the bulkiness on the Emax compared to the Zirconia. And I think it's the milling parameters or how it was
Yes.
milled, because both of them are these are monolithic crowns. Um, the patient rubbed it with his tongue. He says it feels smooth and polished and feels like a natural tooth. He didn't say the Emax didn't feel like that. He just felt that this one felt better. I mean,
Yeah, natural teeth are more like a satin finish. They're not high gloss in the mouth, right? And so a polished zirconia surface that's very smooth, like the Nano, I believe we've had multiple patients now tell us that the polished Rebel Crown feels more like a natural tooth than a highly glazed surface, right? There is a little bit of like satin finish that a natural tooth has. So anyways, this is really awesome feedback. Really good to see. And it was the same crown that you designed for both, which is awesome. And so we're going to chat a little bit about, talk to us through your Exocad design. So as a dentist, you're designing crowns in Exocad. And instead of milling them yourself, you're setting them to Rebel 3D to get milled for you. And so just talk us through that. What are your
yeah,
design parameters? How do you design? And
yeah.
share some of your
So
experience.
yeah, so let's start from the beginning. So for those of you who are not familiar with Exocad, Exocad's a awesome software. It's very robust. It can be overwhelming for new users to navigate it. If you've been using other design softwares, this one I consider it to be just like it's one that it's pretty gets pretty easy once you know how to use it, and it blows all the other ones out of the water. To be honest, this is your prescription. So consider this your prescription. You'll put in your patient's name here, and right now we're using John Doe Rebel 3D. We're going to design number 14, so we'll select 14. Over here, you have your choices of what you're going to be doing. So you're gonna tell the software you're going to do an anatomic crown. And we have material choices here. So we're going to pick zirconia. And for this example, we want to use a pre-op model. And we can also use this copy mirror. Now, if you want to make a crown pretty quick, let's just say you're wanting to make a temporary crown to print, I would use the copy mirror selection, and that way it skips a lot of the steps, and you can design a crown pretty quick. But I'm going to click off of that because we're not going to use that at the moment. And then that's it. That's all you have to select. It automatically selects to pull your margin to the crown margins to where you mark it. So we're going to click OK. It automatically puts an antagonist. If you don't select an antagonist, then it won't ask you to bring in an opposing model. So we're going to save that. Now this automatically creates a folder on your in the Exocad folder software. Now we're going to go ahead and jump ahead, and I've already got the case set up for us. I've got the margins already marked, and we're going to go ahead and generate a crown. So we've got our tooth library here. And
Talk
we
us through really
can,
quick site preparation. Are you packing cord? Like, what's your
yes,
strategy for
all, yeah, every time.
managing blood
Yes.
saliva tissue?
Yeah, you've got to pack cord, especially with these scans, in order to see the margin well. So let's actually look at our scan, and we can look at our margins, right? We can also look at it in color,
Nice. And
which is
what
what I
scanner are you
love.
using?
So this is just the iTero 5D, and
Okay.
it does a really great job with showing these margins really well. So here's my buckle margin, and you can see how it flows all the way around. Now I question kind of what's going on here, so I'll put it in color, and now I can see where my margin is right there.
Nice.
And then so I'll keep marking, and then I know clinically that my margin's right there, but I'll just confirm that by looking at it in color.
So you mark not in color, but you'll toggle back and forth
I'll
to
toggle
check your
back and forth,
position.
right? Yeah. And then here's the margin here, and then it comes around to the buckle. He had some recession with a little bit, non-carious abfraction there, and I asked him prior to, is that sensitive? And he said it was, so I decided to cover it in my crown design. Okay.
Awesome.
All right, so at this point, we want to choose the shape. And he has an existing zirconia crown on number 15, no major restorative on his premolar teeth, and he doesn't have a whole lot of detailed anatomy on these other adjacent teeth. But I do have a scan of what his tooth looked like before. So this was his tooth before. Like I said, he had an abfraction there. He's got a pretty sizable filling and some wear facets. And I wanted to restore this tooth to give him his lingual cusp back. Let's look at how that fits into his opposing. So it looks like we've got some restorative space that we can fill in and give him a cusp back. So for this case, I'm going to use his pre-op, and I'm going to copy the parts of the tooth that I really like. So it really, at this point, doesn't matter what I'm choosing, but I want to choose something that's going to rebuild his lingual cusp. So I'm going to choose this one here. And I'm going to rotate it to kind of fit more into the space, and I'll kind of size it up. And we're not trying to design the crown at this stage. I'm just trying to fit a tooth in here that I feel like will work with the rest of his anatomy. And then I can either flatten it or I can make it really pointed.
Hmm,
But
that's cool.
I'm going to kind of put it, you can also check back and see kind of, okay, so that looks pretty nice. I like that shape. All right, so we're going to move on to next. What's great about the wizard of Exocad is, it takes you step by step. So what it did now is it just adapted the crown shape to the margins of what I marked. And up here, I can add the contact areas to show me where my contact points are now, and then also what my adjacents are. So I can toggle back and forth. Right now, my contacts are way too tight, and I don't have very much occlusal contact now. Now, to kind of fast forward things, and knowing that I want to copy his previous tooth shape, except for this, I'm going to go ahead and just skip all of this.
Okay.
So I'm going to go to the next, and I'm going to get to this adapt pre-scan. All right. Now, let's take off the full anatomical crown of what I'm going to design, but I really want to keep this buccal anatomy. Obviously, I want to add to where his abfraction is. I like the shape of his lingual here, but I really just want to replace a lot of this. So what I'm going to do, and this is cool, is I'm going to exclude certain areas that I don't want. I'm just going to not invert, and I'm going to shrink the size of this, and I'm going to highlight the areas that I don't want to copy. All right, so everything in blue is what I don't want to copy. I want to keep all of this natural anatomy for my crown design. All right, so I'm going to hit adapt teeth. All right, so now my tooth has been adapted. And you can see that I've copied that part, and then I did not copy this part. So the tooth that I chose left me that cusp that's already been designed.
Hmm. Yeah, but you capture that wear facet. Are you going to keep that in there, or are you going to edit that out?
I'm gonna smoothen that out, and then I'll bring the cusp up, right?
Nice.
So my next step, I've got some tools over here. I'm gonna start free forming this tooth, and my first step is just go ahead and smoothen out all of those areas that look rough. Now this area is showing through. That means it's really thin. So we can grab that area and just kind of bring it out a little bit. Bring that out a little bit. Bring that out just a bit. All right. I'm going to go back and we can smoothen that. And I'll check his bite here. Now, you've got cusp, tooth parts, entire tooth, and a ridge. Looks like we have a heavy contact here. So we can take the tooth part and just drop that down a little bit. Bring this down and grab this cusp, and we can bring that into play. Jump back to freeform, go to adapt, and hit static occlusion, and that automatically puts the tooth in proper contact. And then we're too tight for the interproximals, and hit approximate, and it'll adjust the interproximals.
Yeah, and since we're doing model-free crowns, it's important not to have any bulk underneath your contact area, otherwise you could create a path of insertion issue, right?
Yes. Yeah. That's probably, it's not the contact that's too tight in a lot of ways. It's really the path of insertion. For
Yeah.
example, down here, if this is really bulky and you can't get past that contact, then
Yeah, yeah, zoom
it's
in right there because this could show that if you were to mill that, it would not seat because there's some bulk underneath that
uh,
contact.
right. So the way I address that is I'll just smoothen this. I don't like how these marginal ridges are not the same height. So I'm going to grab the tooth parts. I'm going to bring it up. Now, notice I just brought it in higher contact. I'm going to go back and hit adapt, and that'll automatically adjust it a little bit. But I still think this is going to be too high in occlusion. So I'm just going to bring it down just a little bit. Okay, it looks like the contact's open. I'm going to bring it back and drop it down just a touch. Contact's a little too tight, so I'm going to go back and adjust it a little bit. I don't want to see any space there because when you go to deliver this crown, the floss is not going to pop. It's going to be too tight. So I'm just going to bring this in just a little bit. Now again, green is going to be too tight. So I'm going to adjust it again and just check. So I don't want to see any space at all. And then when I look from underneath, I want to see that there is some contact there. Now, since we added here, this is a little too bulky. I'm going to go in and just push this in a little bit and bring that out and push this in because this will be a spot where he'll collect plaque bacteria. Bring it out. And then now, even though there's still some show through right there, what that really is the minimum thickness is showing through. So let's do a cut, and you can see that red line matches up with the full contour right there.
Hmm.
That's what's showing through. So if I move it in and
Yeah,
that's the
it's going
minimum
to show you
thickness.
the, yeah.
Mhm. Now, if I were to just do that and not change it, when I merge this into an STL file, it will automatically bounce that back and give
Yeah,
me that
yeah.
thickness. Now, what I love about this is I give the patient back what their natural tooth look like. So it doesn't feel out of place. It doesn't feel like it wasn't their tooth to begin with. And I just enhanced it. I gave him a new cusp because remember, he didn't have a cusp there. It was all composite.
Mm. Yeah.
So
Yeah,
this is what
some
I added back.
more chewing forces there.
And if we really compare
Wow, yeah,
how
you're
much
really
I've
taking
bulked it
advantage of it.
out,
Yeah.
you've got this abfraction right here. So the blue is where he was before. The yellow is what I added back. The red is the minimum thickness. And I'm really in line with where he was before because the blue and the yellow match up
Yeah, so how often are you using the pre-op scan of the natural tooth as a guideline for your new crown design?
every time.
Every
Every
time.
time. Um, my current workflow right now, and this works in my office. I know it doesn't work in everybody's setting, but whenever you're doing a single crown, your assistant's going to take an impression to be able to make a temporary. It's called that a prelim impression. So there's cost and materials there, and then there's cost and materials of making a crown chair side. So you're using those bisacryl material. And then there's a time with your assistant. So if you've got an assistant that's really efficient in making those, then yeah, that makes sense to make those chair side. But if you want to move on to the next patient and you want to deliver excellence, jumping on Exocad and just copying their tooth from what it was before which is what you're doing by taking a prelim impression anyway. I mean, you're just
Right.
giving them back a copy of what they had. And well, let's say they broke a cusp and you want to replace that cusp. Well, sometimes when you rebuild the tooth up, the core buildup's going to show through the prelim impression. So you're having to like add composite or what have you. If you're already 3D printing, get Exocad and copy their tooth, maybe add them back a cusp, send it to the printer, print it while you can go see or numb the next patient, and your assistant can get that off the printer and deliver you a beautiful printed crown. The margins are great, and the patient comes back, tissue's healthy, and it's a quick and easy delivery.
So you're printing your temporaries based upon the pre-op scan.
Printing my temps, yeah, to make it fast in office, I'm basically copying it and giving it a little enhancement here or there, and just printing it on the Sprint Ray Midas. Print it in less than 10 minutes, and it's ready to glue on.
Nice. So you're doing chairside design and printed provisionals during your crown preparation appointment.
Yeah, printed provisionals. I know that doesn't. It's
Nice.
not going to work for everyone. I know the argument will be, "Oh, how much are you paying for that?" Well, the Midas, you buy 3 capsules that come in a pack, and depending on the material you're getting, right now, probably the more accessible one is all the ceramic crown material. It's about $67 for a 3 pack, so about $22 for a temporary crown. But you're delivering a better quality temporary. Now you can argue
Mm.
my assistant's great, make chairside. Well, then I mean, there's nothing wrong with that. Keep doing it. But when you're short on staff and you can hop in and design a crown pretty quickly and print it, you're giving the patient such a better temporary restoration. They fit better. They're nice and snug because they're adapted to your actual prep. And situations like this where you want to add back this material, a lot of times you're either having to cut away the impression a little bit to be able to fill back in that bisacryl
Mm.
material, or you're adding back flowable to close that margin. So now I get to deliver a nice solid crown, no adjustments, and we just glue it on, and it's great.
Amazing. So, how much time does it take you, start to finish, to design the temporary and then design the crown? And are you using the same file, the temp crown design, for your final? Are you starting over for your final?
The great thing about Exocad is I'll show you, and the answer to that question in short is no, I don't use that as my final. I copy their tooth as their provisional, and I to make that pretty quickly. Now I can run through that in less than 5 minutes, get it to the printer, prints in less than 10 minutes, in less than 15 minutes, we've got something ready to glue on. Now, um, what do I do for the final? Let's just pretend we're ready to make this as a final crown, right? So let's just say this was my provisional. Send that to the printer. Now I want to come back and make the final crown. Well, I just hit the back button. It's going to ask me if I want to discard this. I'm going to say yes. And now I can go back and just spend time in making something that I want to as their final. And I'll send that to you and have you guys mill that. And I get a nice, beautiful zirconia crown.
Amazing. This is super exciting. So, fully digital workflow, designing your temps, printing your temps chairside with the Sprint Ray Midas, and then designing your final and getting a Rebel crown with that. Pretty awesome. Dr. Cimino, you're available for Exocad training, right? So if another dentist wanted to reach out to you for training on Exocad, that's something that they could reach out to you on?
Yes, absolutely. I'm excited to share the knowledge and get more dentists to use Exocad. I know it can be a little intimidating. I know a lot of folks feel like I don't have the time for that. But to be honest, it saves you a lot of time. It gives you more control. The biggest complaint I hear from dentists that I speak with are the lab just won't listen to what I tell them, or they don't follow my instructions, or, I'm tired of having to go back and forth to the lab on a wax up. Um, with Exocad, it gives the power at your fingertips to be able to design cases the way you want them, and it will, in the long run, save you money because now you're not having to do remakes. You're not adjusting occlusion at crown seats. You're not adjusting contacts because you've made it exactly perfect the way you want it.
Amazing. So they could, anyone here that wants to reach out to you, Dr. Michael, rebel3d.com/Michael. You have a page there where they could book time with you. Um, and also want to mention Rebel 3D is making crowns, Rebel crowns we call them. It's a multi-layer zirconia from Harvest Dental. So it's made in the USA zirconia, made in the USA crown. We have a monthly membership that's $99 a month for the membership. When you're a member, you gain access to a $39 multi-layer zirconia crown if you design it yourself. If you want one of our Rebel agents to design it for you, we're happy to do that. That would be $59 for design plus milling. But Dr. Michael enjoys a $39 Rebel crown with his membership and getting fantastic results. Good marginal fit, no contact adjustments, and your seating appointments seem like they're going really smooth.
Yes. Yeah. Yeah, Rob, I want to give you a big thank you for introducing me to the Rebel Crown. And I'm excited to share that with other dentists and get more on board and share Exocad. I think Exocad's a wonderful software. If you're on the fence and but want to see how it works, I'm happy to jump on a call with you and show you some of the things and how it can help you in your practice.
Awesome. Super excited. Thank you, Dr. Michael. We'll be in touch, and I'm sure we'll do more content together.
Thanks, Rob. Look forward to it.
All right.
Bye bye.